Headlines are yelling next COVID because of 5 Nipah cases in West Bengal. And airport checks lighting up again. But headlines leave out context. Tonight, I'm giving you the context they skipped. For those of you who aren't joining live, my live YouTube had me on cooldown, so it wouldn't have mattered. So I had to exit, create this in a Zoom style format. I tried to invite a few people. I couldn't get to you all, so this is as live as it gets. So you're getting a recording. Now, if you stay till the end, you'll know exactly how worried to be, what not to fall for online, and what actually works for your immune system. I'm Dr. Justin Kernut, holistic pharmacist. Don't Google that because you won't find that as an actual pharmacist designation. And let's go. So, by the end of this stream, you'll know 3 things: how to be worried, I'm going to go ahead and share my screen and let's get into all right, I'm going to go ahead and share my screen here. And we're just going to dive right into this. So, again, headlines are yelling next COVID because of 5 Nipah cases in West Bengal. And airport checks lighting up again, but headlines leave out context. So tonight I'm giving you the context they skipped. If you stay till the end, you'll know exactly how worried to be, what not to fall for online, and what actually works for your immune system. I'm Dr. Justin Kernut, holistic pharmacist. Let's go. Now, by the end of the stream, you'll know 3 things: how worried to be, what not to fall for, and what actually works. That's the deal. Now, this is what we are dealing with. So, on the left here, you've got the newsroom in full alarm mode. Deadly virus outbreak, red alerts, breaking news, chyrons, all the noise. Now, on the right, that's where we are going. Calm, fact checked. Okay. Headlines sell fear. I'm selling clarity. What's the difference? Headlines sell fear. I'm selling clarity. That's the clear and distinct difference. So, real quick, this is education only, not medical advice. Everything I'm sharing is evidence based, and my goal tonight is clarity, not panic. If you're on meds or have health concerns, double check with your clinician. But for the rest of us, let's break this down. Again, my name is Dr. Justin Kernut. I'm a holistic pharmacist and AI consultant. So, you guys will see a lot of things coming out from me that is AI driven. How can we go faster? How can we penetrate this market cleaner and more efficiently? This is how I'm rolling. So, on the top here, you've got 40-pound heavier me, and on the bottom, you've got me and my current self skinnier. And I did that with peptides in about 3 months. Check out some of my previous podcasts if you're interested in that. Now, again, this is education, not medical advice. We're looking for clarity, not panic. Okay, here's what's actually happening. So there was an outbreak of what's called the Nipah virus. Now, by outbreak, they mean 5 confirmed cases, one hospital in West Bengal near Kolkata, about 100 close contacts being monitored. So, 5 people infected, and about 100 relatives or close contacts are being monitored. Now, where does the Nipah virus come from? Now, the Nipah virus is a zoonotic RNA virus from the virus genus. Say that 10 times fast, which basically means it comes from a bat. Okay, it's not a bacteria, it's not a parasite. Think bat flu on steroids. Now, it originates in fruit bats, which are basically flying foxes, jumps to pigs or humans via contaminated food like raw date palm sap or bitten fruit, then spreads to humans. It can also spread through dirty wells. Okay, then it spreads to human via close contact with body fluids. Now, let's just stop eating bats. Okay, it can also come from eating bats or anything they've slobbered on. Okay, problem solved. And I'm being a little tongue in cheek here because that obviously won't solve all the problems. Bats are still around. Bats will bite fruit and then urinate around them, and then we pick them. Not we, but people pick them and ship them to us. And if they're not cleaned right or sanitized right, or the pig eats it and then we eat the pig, you know, it can spread. Now, that's the cluster. Instead of an outbreak, they should actually call it a cluster. Okay? It's not global, it's not everywhere. It's one hospital, one region, close contacts under surveillance. That's the real story. And because I know you're thinking it, the answer is yes. There are significant virus or diagnostic labs in and around that area of West Bengal. Hmm. And the reason why I'm doing this live breaking podcast is because this feels like COVID started. I was consulting and talking to and counseling my clients in September and October of 2019, well before it ever became what it became. Okay, they only shut down Nevada in March. So that was a whole 6 months that I was ahead, 7 months that I was ahead of the curve. I had remedies, I had done the digging, I'd done the research. I have actually never had COVID. I've never had it. Now, I don't have COVID antibodies. That's how I know I've never had it. Now, I've had the vaccine. They said that the vaccine, only 50% of them were actually vaccines. The other 50 were like water. Like they had to rush them out into the industry and they probably didn't have enough, so they just rushed out stuff. Half of them were placebo and half of them were actually vaccines. Now, that was a report that was given, allegedly. Okay, I'm going to say allegedly because I don't know, I can't prove that. But if I was forced to get the vaccine because I'm a pharmacist, in order for me to keep my job and to be able to continue making drugs for hospitals, which is what I do. I'm a nuclear pharmacist. I make diagnostic imaging drugs for hospitals, radiology, okay, heart scans, brain scans, bone scans. I had to get the COVID vaccine in order to continue with my job. So, of course, I got it. Full disclosure, I actually went on a cruise later on in, I think, 2022, which COVID restrictions were still very much in play. And in order to get off the cruise ship in Jamaica, it was a fully vaccinated island. You cannot step foot in Jamaica without being fully vaccinated. And guess what? There was no way you could say that I sold out. That's fine. But there's no way I was going to step on. I was going to go on to that cruise ship and not step off into Jamaica. So I got it for multiple reasons, but I got it. Now, I'm very suspicious that I got the placebo because I don't have any antibodies. I don't have short term antibodies. I don't have long term antibodies. My body has no titers built to it. And my wife does. And we only know this because we got life insurance and we have to do blood work. And for an additional $10, you can get COVID testing. And I said, heck yeah, I want to know if we've had COVID. I have not because I had remedies and structured plans on boosting my immune system prior September to it even coming out. Okay. Now, again, 5 cases, 1 hospital, West Bengal, India. Okay. So, verdict number 1, it is a cluster, not a pandemic. Okay. Look at the difference. One room is on fire versus a whole city on fire. That's the scale gap that we're talking about. Nipah right now is a room on fire. COVID in 2020, 2021 was a city on fire. The world in a hypothetical was on fire. Totally different threat profile, and that matters, especially with today's pandemic ridden media. Okay, so verdict number 1, it's a cluster, not a pandemic. Now, here's the next thing everyone gets wrong as of right now. Is Nipah airborne like COVID? The answer is no. Look at the left. Grocery store. You walk in, you walk out, no problem. Because Nipah doesn't spread through casual airborne contact like COVID did. Doesn't have a 6-foot barrier issue. You don't have to wear face masks. It's not airborne. Now, what it does need is close contact. Things like caregivers, bodily fluids. That's why most cases are healthcare workers in hospitals. That's the actual transmission story. And if you look at this picture on the right, we actually get more contamination from the common cold through our eyes. I don't know if you know that. A lot of people might wear face masks. But if you don't wear glasses at all, we actually can receive common cold, flu, COVID through our eyes. Okay, we tend to touch something and we tend to rub our eye, even just a minute rub. Most cases each and every year are spread through bodily fluids. Now, that's the actual transmission story. As of right now, I suppose it could get more virulent or somehow adapt. Things do that. But I just want you to know that Nipah is not airborne. So, my verdict is false. Stop holding your breath in Costco. You don't need to. That's one myth we can just retire right now, right off the bat in 2026, January. Now, you guys might be 6 or 7 months ahead of the curve. I tend to believe that in the crowds that I go with, I'm way ahead of the curve. And so are you. So don't worry. If this Nipah virus becomes something grander, okay, don't come into bodily fluid contact with people. Now, this is the key visual I want you to remember. Now, all my slides are showing up all wonky, so obviously everything's being overlapped, and that's fine. It's just the presentation mode I got here on Zoom. But this is the key visual I want you to remember. Now, there's 2 dials here. There's the left dial, which is the 2 dials on the left-hand column, which is COVID-19, and then there's the right-hand 2 dials of Nipah. Now, I did not create these dials. This is according to science and research, and I'll tell you my feelings on it. But COVID, the spread was dialed way up. It was a 9 out of 10. That's why it became a pandemic. Severity in the middle. Okay? So The spread is at 90. The severity was at 50. Now, I think the severity was way lower. I think it was more around 10 or so. I don't think the severity of it was as much as people are saying. If you had your weight in check and you weren't fearmongered, you weren't scared of the publicity, those were the two biggest indicators, and being old. But I knew lots of old people that were in great shape and they never got COVID. So again, this is according to science and research, not just for nut. The dial of spread is at 99 out of 10, and the severity is, say, half. Now, Nipah spread is dialed way down. I'd say 1, 2 tops out of 10, but severity is cranked to a 9. Nipah has a high fatality viral rate, a high fatality virus that doesn't spread easily. And this is a very different problem than an easily spread virus with moderate severity, moderate/low severity. That's that distinction is everything. Okay, high spread, medium to low severity, or low spread but high severity. Now let's talk about the number that scares people. Okay, there is a number going around that the severity of Nipah is 75%. Now, if you start looking at the data, the research, it's actually 40 to 75%. But fear sells. So they're going to use the upper number, the 75% fatality rate. Now, that is real. The 40 to 75% is real. But here's what headlines don't tell you. That percentage comes from small outbreaks with limited healthcare access. So think of this West Bengal outbreak. There's 5 of them. And 75% of them have already died. Now, I don't know if that's 3.75 people, because those numbers don't quite add up. But 3 to 4 people have passed away because of it is a virus of the brain, encephalopathy, headaches, migraines. It starts messing with the eyes. Okay, and this is real. But here's what headlines don't tell you. That percentage comes from small outbreaks with limited healthcare access. When you have 5 cases, mostly in one hospital, with limited ICU capacity or capability and late care, yeah, of course, the fatality rate looks higher. That's not a feature of the virus, that's a feature of who got infected and when they got treated. So, verdict is true but misleading. Yes, the fatality rate is high, but look at the scale. On the left, you've got small group, close contact, one hospital. On the right, millions of people, global spread, varied severity. Those are not the same threat. As a matter of fact, on the right hand side, which is how COVID spread to begin with, per se, we had all sorts of restrictions to not not to be in crowded public spaces. And again, these are not the same threat, full stop. Here's what I'm seeing in the chat, in my chats that people are sending me, my DMs. Are we going into lockdown mode again? Are we doing lockdowns again? My answer right now is no. Absolutely not. What is happening is standard playbook right now. We went through a pandemic. We have a playbook now. We've seen how it spread. There's actually a game. You can download it. I think it's called Pandemic, and you can actually be a virus and try to spread across the world and mutate yourself as you infect a few people. You get the ability to mutate, and you're trying to kill off the United States. It's actually kind of a morbid game, but you're trying to be as effective of a bacteria and then a virus and then a parasite. And each one of those has different things. Each one is spread easier in certain ways. And then eventually you can get to a prion, which is a brain infection. And I love this game. I think it's one of the funnest games you should play it. It's an incredibly simple game. It just shows a world map and it shows little dots, and you can pick where you want to start the infection. And if you start in a very poor country, large population like India or Africa, then you can make big progress quickly before the world catches on and then starts trying to create a vaccine or a cure for it. And that's how you lose, is if you don't spread fast enough, the cure is developed faster and they beat it. It's crazy. You should go play it. I can put the link below. It is an incredibly fun game. But what is happening is standard playbook right now. When there's a high consequence cluster like this, it is high consequence. 5 people, probably from a lab somewhere down there in a highly infectious laboratory, kind of like before. Again, this feels very much like before. Okay, airports do health checks, temperature screenings, health forms. That's surveillance and precaution. And the news would have you believe that because this is happening, we're going into lockdown mode. And that's just not the case. Precaution is not prediction. So, my verdict: caution does not equal lockdown. Monitoring does not equal shutdown. Remember that. Okay, we've debunked the headlines. Now, let me tell you what you can actually control. And I'm going to make it really simple. 3 things. Here's what I'd tell my mom to do this week. My very own mom. And I love my mom. So, of course, I'd tell her to do these things. And she's actually doing um, all of them, I'd say. To a good extent. Number 1 is sleep. Okay, number 1 is sleep like it's a prescription. Just one night of 4 hours of sleep, not chronic, just one night, can significantly blunt your immune function the next day by up to 70%. That means your natural killer cells drop, means your innate immune system as well as your other immune system, which I can't think of the name of right now, your non-innate immune system. It's like walking around with a security team half off duty or half sleeping while on duty. Okay? Now imagine doing that chronically 4 or 5 hours a night, night after night, week after week. That's linked to more respiratory infections, slower recovery, and higher inflammation than any other one thing you can do. So if you're sleeping poorly and doom scrolling 3 hours more at 1 a.m., your first immune upgrade isn't supplements. It's not. I'm not going to supplements first, at least. It's shutting the phone off and going to bed. 7 to 9 hours of sleep, consistent schedule, non negotiable. Okay, number 2 is nutrition. Feed your immune system. Your immune cells are literally built from protein and vitamins and minerals, not vibes, not coffee, not caffeine, real nutrients, real nutrition. People who chronically undereat or live on processed food, more infections, slower wound healing. And that's not coincidence, that's biology. That's a fact. So I'm saying get protein at every meal. Now, some people have asked me, how much protein, Dr. Justin? You should be getting 0.75 to 1 gram, so 0.75, 750 milligrams, 1 gram per pound per day. So if I weigh 140 pounds, I do, then I need to get between 105 and 140 grams of protein per day. Now, let's make that a little relatable. Okay, here's a relatable 100-gram protein day using what normal Americans might actually eat. I hate this whole, you know, just eat, you know, all this chicken. Like, come on, like, let's actually digest this. So, for breakfast, if you had about 25 grams of protein at breakfast, you'd be looking at something like 2 scrambled eggs, which gives you about 12 grams of protein, 1 slice of cheddar cheese on the eggs, real cheddar, not the processed crap, 7 grams protein, 1 slice whole wheat toast with, let's say, 1 tablespoon of peanut butter on it. It's about 6 grams. So 12 plus 7 plus 6, 25. Now that's breakfast. At lunch, if we decide to get, I don't know, somewhere around 30 grams, if you're looking at a turkey sandwich, okay, that's about 3 ounces sliced turkey breast. That's 24 grams of protein. Slice of cheese or small scoop of hummus on the side is about 6 grams. You're looking at 30 grams of protein right there. For a snack throughout the day, single serve Greek yogurt. Okay, 5 to 6 ounces, plain, lightly sweetened. Please don't get the sugar stuff. About 15 grams of protein. Now, for dinner, if we're looking at 30 to 35 grams of protein, we're looking at 4 ounces of grilled chicken breast or salmon, which is about 28 to 30 grams of protein, as well as a half cup of cooked quinoa or beans. Most Americans aren't into quinoa. Okay, half cup cooked quinoa or beans is about 4 to 6 grams of protein. You're looking at about 30 to 35 with that. That's 100 to 140 grams of protein per day, right there. Most people are eating one good meal a day. I would say maybe that lunch. And they might be doing that at dinner, actually, which is probably not the best. They say dinner should be the best meal of the day. Hopefully, it's at least 4 hours away from sleep. Like, give your digestive system a chance before you lay down, and then you wonder why you have gastroesophageal reflux disease, GERD, or acid reflux. Like, I try to eat at least 4 hours before bed, guys. Chew when you're eating. Chew at least 100 times. Okay, you put something in your mouth, put the fork down, chew 100 times before you swallow. It's the craziest thing. You think it sounds easy, and then you try to do it, and you're like, "This is hard." At least do 30 to 50 chews. 100 is pretty excessive. Okay, breathe while you're eating. Put the fork down and just breathe. Do these things. It's crazy. Eat the rainbow. Eat colorful vegetables. Drink water. I mean, do a little more of high quality water, but do water. Now, before you ever think about buying fancy supplements, make sure your immune system isn't trying to build a fortress out of cardboard. A lot of nutritionists and amazing doctors have referred to the standard American diet, the SAD diet, as a cardboard diet. And it always makes me think, why do they call it a cardboard diet? Now, a lot of these things are in cardboard. You look at mac and cheese cardboard, cereals cardboard, okay, cardboard diet. But I heard a doctor once say, fortress out of cardboard. Don't build your immune system. Make sure your immune system isn't trying to build a fortress out of cardboard. And it just hit, it stuck. That's incredibly well put. So, sleep is like a prescription. Feed your immune system. Then, and only then, number 3, then add strategic armor. And I want to be clear, sleep and food come first. Supplements are optional. You should not need them. However, in dire times of things like COVID or pandemic or outbreak or Nipah, I would add on, why not, some supplements. Okay, they're the armored plates on top of the foundation. But if you want them, here's my big 3 that move the needle. You got vitamin D3. It's like an immune thermostat. Most people are low. If you supplement, you're feeling that gap. Go out in the sun, try to get it through your skin. It's obviously the better way. But if not, take a supplement, you'll fill that gap. Now make sure it's a complex, a vitamin D3 complex. Make sure it's with vitamin K. You can also put some magnesium with it to help it absorb and get in. I like to put vitamin A and vitamin E with it. They all just kind of help move each other to the right spots. So number one is vitamin D. Number two is zinc. It's a cofactor for immune and antioxidant enzymes. Too little, and your repair crew is understaffed. Okay? And if you lose your sense of smell and your sense of taste, it's most likely zinc is the cause. So when people lost their sense of taste and smell because of COVID, it's because their zinc was being used completely on bolstering their immune system and was depleted as fast as they could. So they lost their sense of taste and smell. You boost that and you boost your immune system. I'm going to give you a freebie right here. If you pair that with quercetin, quercetin and zinc create what's called a zinc ionophore. And that is a supercharged and revved up way to bolster and boost the immune system. It is incredible. Okay, but zinc, make sure you got zinc. That's number two. And number three is N-acetylcysteine or NAC. It is an antioxidant. It specifically supports your upper airway, your upper respiratory system. During cold and flu season, where your upper respiratory system is affected mostly, make sure you're taking NAC, N-acetylcysteine. It bolsters the glutathione system, and it definitely boosts your fighting against upper respiratory tract infections or pulmonary issues. Now, those three together give you a solid backbone. Now, I use 8 nutrients total in my full protocol. Can't rattle them all off right now. I feel like most of my lectures that are too long make people fall asleep, too much content. So here's what I'm going to do. Comment Fortress 2026, all one word, capital, or however you can spell it. I don't even care. I'll get it to you. And I'll send you the full list. Doses, links on where you can get these things. They're my tried and true vetted products. That's where the complete protocol lives. You have to comment Fortress 2026. No dosing is provided here on YouTube because they don't like that. They try to demonetize me every time I try to give dosing. And I don't want them or anyone to think that I'm your prescriber. Go talk to somebody, your professional physician or professional medical staff. Have them help you. Make sure this regimen fits with your lifestyle and your diet. Now, Nipah is serious. Okay, it's not global. Okay, Nipah is serious, but it's not a global wildfire. Yes, there's smoke, and where there's smoke, there's fire. But let's keep an eye on that room that's burning, not the nation. Protect your sleep, feed your nutrition, lay your smart tools if you want, and you'll be prepared. So here's what I'm asking. Comment Fortress 2026. Let's see if I can go back to all right, let's go back to me. I guess we don't need to look at slides anymore. But all right, let's go back to me now. So here's the reality. Nipah is serious, but it's not a global wildfire. So here's what I'm asking. Comment Fortress 2026. If you want the full supplement protocol, I'll reply with the entire list, doses, and where to get them. Like this video if it helped you. Breathe a little easier. Like this video if it helps you breathe a little easier. Algorithm loves calm information, not panic. Subscribe if you want more evidence based health breakdowns from a pharmacist, not hype, not fear, just clarity. And if this continues to become an issue, I will keep doing. I'll lay out every single vitamin and nutrient there is and how in depth it works. It is irrefutable. My COVID protocol, for example, it's irrefutable. It works. It stops it from entering. It blocks it from absorbing. It has to hijack your own cells in order to copy itself so that it become rampant throughout your body. And I nipped it in the bud. There's about 26 different steps that it can take, that it needs to take in order to become viral in your body. And there's 12 steps that I went through according to research. It's all laid out there that block COVID from becoming viral. And I had a whole presentation, a whole protocol laid out with 12 different supplements that blocked each and every one of those pathways. And I narrowed it down to the top 3 supplements that you could take to nip it in the bud. I'll tell you my number one because COVID is still an issue and it's still going around. And each and every year they're saying, oh, you need to get the new, COVID vaccine, It's licorice root. A licorice root. Now, licorice root is actually not even in my Nipah formulation, my Nipah formula, and my my Nipah Fortress 2026 immune system boosting protocol. It's not. It could be because licorice works on viral issues. It works on about 10 of the 12 different pathways, specifically when involved with COVID. So, will I still be taking it? Absolutely. I take it if I feel a little tickle in my throat, if I know I'm going into public, I take licorice root. I haven't been sick, knock on wood, in about 6 years, actually. I haven't really had to take a day. I haven't had to take a day off work. For me personally, for other people, yeah, for caregiving, absolutely. I try to give my kids, I try to give my wife these things, but sometimes they just don't listen, don't want to. But comment Fortress 2026 if you want the actual protocol. Like this video, subscribe. Those are free things. The algorithm loves it. Subscribe if you want more evidence, more breakdowns from me, not hype, not fear, just clarity. Thanks for being here. I know you guys could be in 100 other different places. So thank you. I appreciate you being here. And go get some sleep. Go meditate. Go eat better. I'll catch you guys in the next episode. Thanks.